Well, good morning, everybody, and welcome to Seattle. I'm hoping that the fog will lift later today, and we'll get a beautiful day maybe during lunch when you get a little chance to get outside. I did not grow up in Seattle, but it has obviously become my home, and Bill and I travel around the world, but I always look forward to coming back to Seattle. I wanted to start this morning with a song, and as my kids always say to me, I have 3 kids, "Don't sing, Mom," and I'm not going to sing, I promise you. And a little background first before I play the song, which is really brief. And this is why we're here, which is the power of the song that I'll show you is really in the power of the story of what's happened along the way. When you go back and look at the cutting edge science about emollient therapies, that is what you should massage a baby with, we had a great set of researchers who set out across in 8 different places, researchers in places like Dhaka, Bangladesh, or from University of California at Davis and Johns Hopkins. These 8 researchers worked together and they said, is mustard seed oil an appropriate thing to be massaging babies with? Because we know that many millions of women do this in India. And in fact, we suspected that in fact that wasn't a good thing for babies, that we were introducing infections into the preterm babies. And that was the case when they ran this piece of research. And they said, what other emollient therapies though would be appropriate? And they tested some very expensive solutions like Aquaphor, which is something we use here in the United States. But they also tested things that existed in the community: soybean oil, sunflower seed oil, olive oil. And they said, do any of these harm the baby or have a protective effect? And it turned out that sunflower seed oil, in fact, had a very protective effect for a preterm infant. And if massaged appropriately, kept infections out of the skin of an infant. So given this cutting-edge science that was done about simple massage oils, and knowing this was a practice done in India that we wanted to maintain, then the question became, how do you make sure that mothers switch from mustard seed oil to sunflower seed oil? And it turns out in a village in northern India, we worked with community healthcare workers, and in fact, a government school teacher who came up with a very catchy phrase and song, and as you know, a jingle that gets in your head often sticks, and also a community healthcare worker. And this was the song that they came up with. Let's play it. Noticed that 2 of the people sitting there in the community were Gary Darmstadt and Vishwajit. Where's Vishwajit? There he is. Vishwajit is the researcher who's working on this cutting-edge research up in the northern state of India, Uttar Pradesh. So what I love is that they're using local songs, local jingles, local instruments, but you wouldn't believe, if you read the verses, which I went back and read last night, all the messages they get into this song. They speak to the grandmother because she holds the power in that social circle. They speak to the mother. They speak about getting the massage oil in the right places on the baby and where to avoid getting the massage oil. All of that in one powerful song that then we hope will continue to be spread to many, many villages to change this practice just ever so slightly so that it works in a culturally appropriate way and actually saves the lives of newborns. And I think that's the thing I want to emphasize today, is that everything we're talking about spreading are practices that we have to know first make a difference. And then we have to figure out how do we spread them. So finding these innovative solutions like these to encourage and spread the uptake of health innovations really is the reason that we're here today. And I'm thrilled that we're holding this convening on this topic, because for me, it's a significant milestone in the journey of our foundation. The journey of our foundation started in the early 1990s when Bill and I first saw an article about rotavirus. For those of you that don't know rotavirus, it's a disease, it's a diarrheal disease that kills many million, almost 1 million children die of diarrhea around the world every year. About half of those die from rotavirus. And we read this article and we said to ourselves, how could kids around the world be dying of diarrhea? And in the United States, we go down to the drugstore and you get an over-counter medicine that solves basically diarrhea in our country. And it's that question that led us to start asking many more questions about what was going on in the developing world. And one of the things that we've learned over time is how to begin to work on these problems. And the reason that we're interested in working on these problems is because we see that when health improves for a person, they are able, and they get an access to something like a family planning tool. They can have a much smaller family. They can then feed that family. They can educate those children. And a virtuous cycle begins of economic opportunity for that family. And it's that virtuous cycle from health all the way through education that we're interested in. So that's why we have this goal of reducing childhood deaths. In fact, if you look at the primary goal of the foundation's work, it's first and foremost, and where we started, was reducing childhood deaths. Bill and I believe absolutely that vaccines are a miracle technology. One of our favorite statistics, if you go back to 1960, which is around the time that I was born, there were 20 million children dying every single year before their 5th birthday. 20 million children. Now we're down to about 8 million children dying a year. And I want to tell you that 8 million children to me is still way too many children. But when you think about that, from 1960 to last year, we've had a 60% decline in the death rate of children under the age of 5, while at the same time, the birth cohort rose by 25%. That's an absolutely astounding number that we've gotten that number of childhood deaths down. But again, that 8 million is still a tragedy, and it's still something we can totally do something about. The other question that we began to ask ourselves, I think, as a community is, take those 8 million deaths, and where do they happen? And why do they happen? And yes, vaccines will get still a chunk of those deaths, but they're only going to get the deaths from basically after the first month of life to 5 years old. They're not going to tackle the deaths in the first month of life. And a great land-breaking piece of research that was done and then published in The Lancet in 2005 explained that at that time, about 4 million of the deaths came in that first 30 days, that neonate period. We weren't even doing anything as a world to address the neonate period. And guess what? A vaccine has nothing to do with those first 30 days. So if we want to tackle those 4 million deaths, we've got them now down to about 3.3 million, we have to do other things. And it's the things that we're talking about here today. That's the piece I'm really, really interested in. We know things like immediate and exclusive breastfeeding is really important. Keeping that baby warm, the kangaroo care that Gary showed you this morning, not introducing infections, massaging the baby appropriately. We know that we can get another 1.3 million children likely to survive if we get just these social, what I call social and behavior changes to happen in communities on the ground. Now, where do we need to get them to happen? You need to get them to happen worldwide, but we really need to go after the places where there are many, many babies born and who don't have this kind of life-saving technique. That's 2 states in northern India, Bihar and Uttar Pradesh, both of which are really trying to tackle these issues. It's places like Ethiopia and places like Nigeria. These are really low-cost interventions, but we've got to figure out how to spread them. And for us, the challenge is not to have pilots all over the world. Pilots show us the guiding lights and the ways, but we've got to scale these things if we want to go after 8 million deaths, of which almost half are in that first 30 days. And I think if we're successful, the rewards will be absolutely huge. It means neonates not dying. Now, I'm not saying that this is easy. We know things like oral rehydration salts have been around for years. We still know that lots of children die of diarrheal diseases, and yet we have a simple low-cost intervention. You can give a mother oral rehydration solution, but women aren't using it. Why aren't they using it? We still don't have the answer to that question. We have some reasons we think ORS hasn't been popular and it's been hard to scale, but we really don't know. There's lots of speculation. So we don't know what is it that has a woman? What is that power structure that allows her, not allows her, or reasons that she'll take up a new intervention or won't? For instance, in Uttar Pradesh, we know that lots of women today put oil on the umbilical cord, and that's not a good idea because the umbilical cord needs to dry and needs to fall off. When you ask women in the village and you start to explain to them, okay, it would be better to let the umbilical cord dry and fall off, you say to them, well, what would you do? What other message would you give? And they said, well, they kind of scratched their head, actually, I think when Vishwajit and his team came in, and they said, well, it's easy. Let's explain it to women this way. We have 2 pieces of chapati bread. One of them, if you put them out in the sun, one you put oil on and one that you don't, which one's going to dry first? The one without the oil on it. And as soon as the women started explaining it to each other in this way, they said, oh, well, that makes sense. If you want the cord to dry, yeah, let's not put oil on it. And guess what? That song about massage, they incorporated into it, don't put massage oil onto the umbilical cord. So we need to innovate in these places of social and behavior change. Some of the questions I think that we should be asking ourselves, and I really think it comes down to the power of the questions, of knowing where we should probe. What if we could develop effective channels to communicate these messages? What if we could have more effective channels to get the messages out? What if we created large-scale marketing approaches to mobilize the local networks that already exist? There are many, many grassroots networks that exist on the ground in places like Malawi and Ethiopia and India. What if you could really mobilize those groups for change? What if we found creative solutions to overcome the social, cultural, and financial barriers that prevent mothers and families from adopting these life-saving practices and behaviors? This territory is unfamiliar, and it's sometimes a little bit uncomfortable for people in the global health community. But I know progress in advancing the spread of health solutions and social behavior change is possible, and I've definitely seen it happen. Last year, in fact, I got to visit Shivgarh, the site that Vishwajit works in Uttar Pradesh, a northern state in India. And just using some of the tools we've talked about today, immediate and exclusive breastfeeding, getting mother-in-laws to not tell their daughters that they should give goat's milk to the babies or mix milk with dirty water, but immediate and exclusive breastfeeding, keeping the baby warm and not washing the baby, massaging the baby appropriately with the right oils. We know we can get over a 50% reduction in 15 months in this site in Shivgarh, a 50% reduction in neonate death just in the first 30 days. That was shown over a 15-month period. That is something we absolutely want to scale up, making sure people know those cultural practices can reduce neonate deaths by 50% would be huge. So these messages are powerful. We know they can take effect, and we know scientifically that they make a difference. There are also a handful of examples that happen in South Asia and several countries in sub-Saharan Africa. And now we need to evaluate some of those successes as well so that they can be extended to other places. I think some of the questions are, which strategies will help behavior change remain intact for generations? Not just so we teach this generation some of the changes, but how do you make sure those cultural practices remain generation after generation and are passed down? How do we adapt these village-level interventions for places where birthing practices are different from one another? How do we scale up effective behavior change programs so they can help millions of children and people a year? These are the kind of questions that you all will be tackling over the next few days. Gathered in this room are some of the greatest minds in global health. We have policymakers here, donors, researchers, industry leaders. Each of you comes with your own experience from the field or from research or the community that you work in. But I think we all share a common vision of a healthier future for children. So I challenge you at this convening to share your knowledge and your insights with one another. I hope you challenge each other's ideas and assumptions. I hope you challenge the status quo, because that's what we've got to break through. We've got to change what's going on across the world. We have tools and we know some practices to save babies, but we have to find ways to encourage the spread and the uptake of these practices and to sustain them. When it comes to these challenges, Bill and I say we're optimists, but we're impatient optimists. I'm interested in change in my lifetime, and I'm interested in change even sooner than that for these millions of children that die. But we're optimistic because when we travel around, we constantly meet people whose lives are better and have been transformed by innovations in health. In our view, the world is getting better, but it's not getting better for everyone, and it's certainly not getting better fast enough. We believe through the power of innovation that we can create a better future, a future that we can start today. So I challenge all of you in this room to also be impatient optimists. I do think together we can build a better future where every child has the chance to live a healthy and a productive life. Thank you.